This is a brief presentation describing the Emmdata integration and healthcare delivery platform. A brief history of Emmdata. It was founded in 2004 by Don Hughes. He came out of the TPA world and was the CIO of North American Health Plans, a 500,000 life plan administrator in upstate New York. This experience, coupled with consulting, resulted in the decision that analytics and information are vital to healthcare at all kinds of levels. Over the history of Emmdata, we have provided services to major carriers, employer plans, Taft-Hartley plans, medical management vendors, reinsurance carriers, consultants, and provider organizations of all kinds, hospital groups and medical clinics. The platform is very, very broad. It encompasses the breadth of healthcare. The objective is to allow for the integration of data from all kinds of disparate sources, not just the administrative data, that's eligibility, medical claims, and pharmacy claims that is typical, but to allow all data that's available for patient profiling and for provider profiling to be gathered together. The platform provides for analytics that allows validity in interoperability, that allows us to marshal data for informed decisions by decision makers. The reporting elements of the platform are extraordinarily broad. It allows us to deliver information at a level that the user needs. And by that I mean it can change according to whether it's the CFO making the decision and needing information, whether it's a clinician making decisions about a patient, whether it's a plan designer testing what can work and what won't. Data integration is a key. Historically, medical claims, medical pharmacy data, and all of the data surrounding healthcare have been created in silos for specific purposes, and they just don't talk to each other. What we've solved with the platform is we allow all of these disparate sources of data to be able to be used in single analyses that give broad, deep understanding to the questions that healthcare is demanding to be answered. We deliver most of these through client portals. There's all kinds of other mechanisms where delivery happens. That's also through direct flat file integration with programs on a client side or others, but primarily they're through web portals that allow us to control what is going on and what is happening, and also to assure that we are achieving HIPAA compliance. The web portals are designed to serve many needs. People that are interacting with the platform need information at multiple levels. They have multiple levels of skills, and they also have multiple areas where they just can't function. For example, somebody that is looking at extreme data analysis may have to have a background in programming in order to make use of the data. We need to make that same information simple, available to those that are using it. Asking the HR director to be a master of data may be asking too much, but being able to deliver the information in a way that allows him to make or her to make important decisions about the plan is crucial. It's configurable. That's the key, is that we can configure to the needs of the client. And we can configure to the things that exist now, and we can also add future unknown data sources as they come in. By making the platform broad, we've solved the administrative data issue. We've solved the issues around how we bring in EMR and HIS and registry data and those things, so that those things can all come in and be very, very effective. New socioeconomic data, new holistic employee patient environment initiatives that are all becoming popular. We can bring those in as well as we do those. It means making sure that we understand the impact on the modeling and on the predictions and on the results. But as we do that, they then become components that can be added. Quick example, if we wanted to bring in social and clinical analysis in a joint analysis, We could set up how those are to be done. This is an example of one that wants to run from patient risk, but wanting to break that out into categories of interventions: preventions, early intervention, and care management, depending on what level of risk and stage of diagnosis they're in. This is a more detailed example of how we would emphasize the value of the content and the data. It's a way of showing a complete integration with a in this case a carrier that can interface at different levels and different layers on the services that we need to bring to bear to allow for the outcomes to happen in an appropriate way. Similar diagram for a employer-sponsored health plan is an illustration of how the data can be integrated, massaged, and transformed so that that it supports the decisions that are important for that group. Turning analyses into actionable information is crucial. And the reason that that becomes vital is because it's just noise unless it allows somebody to do something with it. We can create analyses, and from those analyses we can devise profiles for patients, their status. We can provide profiles for providers. We can look at those in all kinds of ways. We can look at them at the individual level, and we can also look at them at various aggregate levels. We can look at them by plan type if it's a health plan that sponsors multiple plan types. We can look at them as trending. We can look at them as time over time. We can look at clinical status. We can predict cost implications. We can look at provider performance. That's becoming a crucial area with the value care movement that's going on. We've got to be able to analyze, monitor, and know the components and the impact of those that have on the overall plan. The way we've been able to do this is by componentizing the data analytics. By integrating them into components, it means we solve the problems once, essentially, where we do the major development and validation and integrity checks and those kind of things. But once we understand that, how that fits with different data sources and models, it gives our clients the ability to bring those reporting elements and those management elements in. And as they grow and have access to more data, more kinds of information, those can be added in. It also lets us get at the big data problems. By componentizing, we've been able to solve the problems of parallel processing, being able to deliver near real-time analytics in many cases. This allows us that whenever there's sources of changes, even if they're minor at an individual patient level or at a plan level, those can be integrated very, very quickly, even near real time in many cases. We do this by creating libraries for functions. It means that when we are doing an install and a configuration, it's picking the elements where the client is now with the problems they need to address and need to solve, and being able to get at those in a quick and easy way from existing libraries. This makes it a configuration issue rather than a development issue every time. The libraries break out into a number of major categories. Data management's an important one. This lets us do amazing things like temporal modeling, profile creation. Temporal modeling has become crucial. If you think of health claims, typical health plan, the claims are going to be adjusted in 25 to 30%. So that means when you look, it makes a difference. By temporal modeling, we can see exactly what the status of the patient or the provider or the problem we're addressing existed at any given point in time. We can also trend that to show how those things change. That leads to huge process improvement opportunities. The medical management and service delivery components allow us to support innumerable programs. It allows us to look at things like provider efficiency, provider effectiveness. It lets us look at the value care components to be able to measure what those kinds of contracts will look like and impact on patients and on revenues. We can look at the actuarial support sorts of libraries that are the more traditional sorts of things that population analysis looks at. We can look at things on line of business that can be defined as a plan offering, a business offering. If I'm a consultant, it may be each of my clients that I have that are a separate line of business that sometimes I want to look at as a group, sometimes I want to look at as individuals. Network management is a piece that grows out of this. Networks have been changing dramatically over the years. As we get into the new ways of managing providers and as provider groups have become more powerful and push back against carriers, managing niche networks or boutique networks or just individual net providers that are looking for best outcomes of what they can get for their services. It allows us to pull those together and manage those in dramatic ways that improve the outcomes for patients, for providers, and for plans. Our current initiatives that we're pushing that we've launched initiatives on include our school district special education initiative. This is an area where medical services are being required by the government. Districts are falling far short. Implementation of our telehealth sort of programs allows us to extend the reach of therapists well beyond the four walls, increasing productivity, reducing costs, and improving outcomes. Our provider network management is becoming increasingly important by being able to take virtual networks and being able to assemble them in ways that are cost effective and outcome specific effective. It can make a huge difference. We're also committed that telehealth is a wave of the future, not only the future, but the right now. It allows a provider to deliver services in more compliant, HIPAA compliant ways to improve the privacy of patients and also to improve the outcomes of patients. The other area that we are focused on is the newly created association health plans. We are convinced that over time this is going to be a major change in how healthcare is delivered. The kinds of things that we are dealing with, sometimes the words get in the way, so I've included just a brief glossary of how we're using the terms. Like for an example, outcomes is a good measure. Outcomes come in all kinds of ways, and we need to address them all. We have financial outcomes, we have clinical outcomes, we have plan performance outcomes. And when we're using those words, we need to understand how those are working and what they mean within. Now, we've done that with our delivery system inside of the platform, of being able to define those very specifically and make them client-driven. Well, I hope this has helped give you a good, brief understanding of who we are and what we're offering and what we do.